Hello, class. Dr. Miller here. Hope you're excited. You are in the final stretch, the home stretch of the course. We have week 7 and then our short week 7.5, that last half week at the end. I want to spend a few minutes reviewing the work that is going to be expected in week 7. Our topic for this week is the exchange of health information. So make sure that you are starting out the week by reviewing the lecture materials and downloading the Word document with the lecture materials and adding that to your lecture library. Make sure also at the same time that you have a copy of the lecture materials from weeks 1 through 6 also, because you know what? Next week is the final exam. What is the final exam made of? Questions from the lectures. So you want to make sure that you have those materials available to you for the final exam. Okay, so after you've completed the lecture materials, you're going to jump into our discussion. And the discussion is really looking at health information exchanges or electronic health information exchanges. And this is the process of information being electronically transferred between providers to ensure updated health information is available to improve the quality, safety, and cost of care. This exchange is possible when providers meet particular standards and guidelines, which can be facilitated when a provider pays to be a part of a health information exchange organization. HIOs are responsible for overseeing and assisting in the exchange of health information. So we can see these information exchanges occurring in a number of different manners. There are formal health information exchanges that could be regional, maybe statewide, and different providers are participants, and they may send certain pieces of data to the exchange and also be able to receive certain pieces of data. So it may be patient medications, patient allergies, lab results, those types of things. We also can see exchange of information through particular vendors. The one that I immediately comes to mind is Epic Systems, which is the #1 medical electronic medical record, electronic health record that's used across the United States and also globally. And they have built into that system because they have so many healthcare organizations that use Epic systems. They really have their own network or their own health information exchange between Epic systems users. So, for example, my healthcare provider uses Epic systems, and I use the Epic app, MyChart, which works as a patient portal. But I have it for my provider. My dentist uses Epic systems, and our local teaching hospital also uses Epic systems. So I can go into that app and I can see, oh, here's my regular provider, here's my dentist, and here is the teaching hospital in the area that I may have received care at. And those entities can send and receive patient information through Epic systems, and it's important when we're thinking about how effectively and efficiently we are providing care. So if we have a patient that is either participating in has a provider that's participating in one of these kind of standalone health information exchanges or something similar to like Epic Systems, and let's say I have a medical emergency and I go to that teaching hospital. That teaching hospital can access things like my medications, my prior lab results, my history of conditions that I've had in the past. they would have access to that so it doesn't impede the care that's being received. So there are some huge benefits. Some of the things that we think about when it comes to health information exchange, though, is participation in it. Now, we may have providers that participate in it, but the patient also has a say in whether or not their information is shared. And there's one of two ways that that happens. There's always a notification to the patient that their provider is participating in this health insurance exchange. That provider then says, am I opting in? Am I going to have my patients opt in to participating, or am I going to have my patients opt out of providing? Of participating in this exchange of information. So if I have a provider that uses the opt-in method, when a patient presents for care, the patient would automatically be opted out, not participating. The patient would have to say, yes, I want to participate. The opposite is the opt-out method, where the patient will be notified about the health information exchange, but automatically the patient is opted in. That patient has to make the decision to opt out of participating. So be thinking about that too. What do you think would be better, the opt-in or the opt-out for participating in this information? In the case of my healthcare provider, they have an opt-out method. So by default, all patients are opted into the exchange. That they're given information about it. They're also given the opportunity to opt out of participating. Okay, so that's the discussion. Make sure that you are participating early enough in the week that you have an opportunity to earn full credit by a number of days and number of responses to classmates. The next assignment that you have is the Health Information Exchange Assessment. I have open here the directions. Here you can see it. What you're going to do is you really have two steps. Your first step to completing the assignment, you're going to complete this little table here with benefits and barriers. You are going to right here use the table below to compare and contrast at least two benefits and two barriers of implementing interoperability status when exchanging electronic health information. Once you have done that, in at least 550 words, you are going to explain how electronic exchange of information can lead to improved health outcomes for patients. That's the benefits of exchanging electronic health information. Then you are going to analyze one of the barriers included in your chart that a provider may experience as they attempt to achieve interoperability status. Then identify and explain resources, service that are available to the provider to overcome that barrier. And you can make sure you read your lecture material first. You're going to find some good information in there. You will also find the grading rubric. This is what I will use to grade your paper. And don't forget your research references. You also have your template here at the end with your title page, and then just these prompts. So as you're working, you write your introduction, take this out, make it your own. And then don't forget your references. Look, we've already have the lecture material cited for you. So any additional you will go ahead and include in there. So that is the Health Information Exchange Assessment. Then you have your portfolio project final submission. So refer back to your draft that you submitted already. And let me pull up I have the directions up here. So in week 5, you submitted your draft. You are going to refer back to these instructions. Make sure that you've picked one system. I know we had at least one assignment that was turned in where it was basically the discussion again where they listed all three. You're picking one. You are picking one system, clinical, financial, or operational, and then writing a 1 to 2 page double line spaced paper and submitting it. You are going to address these three prompts here, identifying the type of system to be implemented and its function within the hospital, justify your reasoning for selecting the particular system, compare and contrast the benefits and drawbacks associated with the system. Each of these bullet points should be in a separate paragraph. Okay? So use the feedback that I gave you to make your updates, your edits to your paper before you submit it. And then you're going to upload it to your portfolio project. Here are the outcomes that you are going to select when you upload it. If you are in the Health Services Administration, Health Services Administration Assistant Diploma program, you're going to be selecting community and career, participate in social learning and professional communities for personal and career growth. If you are in the Associates Health Service Administration, use current technology from clinical, financial, and operational systems to support decision-making processes. And if you are in the Bachelor of Science Health Service Administration program, you will use research information management systems to evaluate and select technologies appropriate to a particular healthcare setting. Okay. Then, after you have submitted that, you do have a 150-word reflection to write. A variety of different programs and initiatives have been created that support the exchange of health information electronically. The electronic exchange of information is really most valuable when all parties are involved and meeting the standards necessary to facilitate the exchange. One of the parties associated with the exchange of information and this increase in access is the patient. Okay? Think of a time when you requested access or information from your medical record. Perhaps you were switching providers, seeking care from a specialist, or you wanted to reference your own medical history. Reflect upon how this information was shared with you and the other providers. Then think about increased transparency with you as the patient, and access to your health information could impact your experience with your providers. Okay, so those are your assignments for this week. On Friday, we're going to be transitioning into also week 7.5. Week 7.5, you're doing some reflections, but most importantly, you are doing your final exam. So this week, make sure that make sure you have all of the lectures from the course downloaded. If you have any questions between now and Saturday, don't hesitate to reach out to me. Thanks a lot and have a great week.